Hi, this is Dr. Tom Rogers at Performance Medicine coming to you today for our weekly podcast with a fascinating subject to talk about. It's one of my favorite things to talk about. It's one of the most important and powerful chemicals in our body, and it's a neurotransmitter. It's called dopamine. There's really two main pathways that dopamine go down. The first one, which you've all heard about, is the movement pathway. Think about Parkinson's disease, where you can't express yourself, you can't move, you have the shuffling gait, you get dementia. That's one where your dopamine gets depleted in your brain in an area called the substantia nigra. Now, dopamine is very complex. It's neurophysiologically, it's in your brain. There's a lot of different complex stuff we're going to talk about, but I'm going to kind of make it simple. And I want to make it simple because the second pathway is what I'm really interested in talking about today. And that pathway is what I call the motivation and mood pathway. There are vesicles that release this chemical called dopamine in your brain. And it acts in a couple ways. One, locally at the synapse, and two, volumetrically, which means broadly in volumes. They have different reasons and different purposes. So I call this a baseline and peak level of dopamine. And so think of dopamine as a currency. It's a way of tracking your success at baseline levels. And then you can get dopamine hits, like when you eat chocolate. You feel good for a few seconds right after you eat chocolate because it turns on the release of that dopamine. All the way to cocaine. Now that gives you a huge hit of dopamine. It'll make you crave more if you repeatedly hit this thing. So you get highs and then you deplete your dopamine. The baseline is different for different people. Genetics are a lot involved. Think about Winnie the Pooh. Think about Eeyore. And, you know, the lazy, I guess Eeyore was a mule, I think. But anyway, just always sluggish, lazy, kind of in a bad mood. That's dopamine depletion. And then think about somebody that's really hyper excitable. I can't give you a great example right now of this, but think of somebody that's always on. They probably have just more dopamine in their system. So dopamine also interacts with adrenaline. Another word for adrenaline is epinephrine. So you're going to hear me talk a lot about epinephrine, norepinephrine. But think of adrenaline, that thing that really kind of gets you going. I talked about chocolate. Chocolate really increases your dopamine by about 1.5 times baseline, just for a few minutes. Sex increases it by 2 times. It doubles it. Nicotine, 2.5 times your dopamine. Exercise, 2.5 times your baseline dopamine. It's interesting that caffeine, like when you drink coffee, just a very slight increase in your dopamine levels. Now, when you talk about taking an amphetamine, it 10 times the amount of dopamine that you get in your system. The thing about it, you got to watch out for too, if you layer too much of it together, it really leads to depression because you kind of overdo it and it depletes it. It's like it gets peaks and valleys. Think of Christmas Day. You know, Christmas Eve, Christmas Day, you're all excited, you get up, you open your presents. Then what happens on Christmas night? You're kind of tired and almost depressed a little bit. So, you know, you get these highs and then you get lows. And it seems like the higher the highs, the lower the lows. Think about postpartum depression. That's a high and then a low, which can be very serious and always needs treatment. Why do we have dopamine in the first place? Well, It has its functions. Reproduction is the main function of the human race or any species, really. Um, Another one's seeking, like seeking food and water. You get rewarded. Dopamine is kind of in a reward pathway. Um, but it's interesting to think about your baseline and your peak. Um, if you peak too much and have continual hits, it's called addiction. So we have so many addicted people. They're addicted to dopamine, or the feeling that dopamine gives you. Think about gambling. You can't really beat the house in gambling. But they keep you addicted to it by making sure you win some. Look at video games or continual texting or social media addictions. You need to be very careful about these things. I think too many people today are addicted to these things, especially younger people. Social media can get you in all kinds of problems. It's very addicting. It turns on that dopamine, that need for reward, for attention, for craving. So if you find yourself in this pattern, like you're continually playing video games, you can't stop, you're texting, it's interfering with your social interaction with real humans, then you need to take some time off from it. Like if you're a gamer, you're getting addicted to it, take a month off from it. So you have to manage your dopamine. The key to this thing is intermittent release. Don't chase the highs and don't layer things with it that raise it. I do a lot of things with the football team and through the years, and we used to have this energy drink called Spark. And I used to watch the players drink a lot of Spark before the game. And it really kind of did them in a little bit because by the second half and certainly by the third or fourth quarter, they were worn out. They were too high when they went in. These guys are high on a Friday night anyway. If you've ever been into a locker room in a high school football game before the game, those guys are hyped up. They're about to go out and hit somebody and get hit. So they're about as hyped as any human I've ever seen. It's kind of like Marines getting ready to go to war. So they're hyped. They don't need anything else to make them higher because it's going to bring them down, especially if they lose. So be careful with layering. It's very distracting. It's interesting that coffee's okay in moderate amounts. It actually kind of upregulates your dopamine so it doesn't wear it out. So there's energy drinks, not so much. I really don't like energy drinks because they kind of overdo it. There's too much in there. There's medicines like Adderall and Provigil, and these drugs can be very useful in certain cases. We've certainly had many gratified patients that we treat for ADD, adult ADD, and it can change their life around. Provigil is a medicine that also increases dopamine. It does it by a little different way. We usually treat narcolepsy with it, or shift worker syndrome. Jet pilots sometimes take it before a mission. Provigil can be a pretty good drug, really, for a lot of people, as long as you know how to do it. And the thing about it is that you need to give it breaks and realize you don't need to keep working your dose up, and you need to only use it for those activities that it's intended for, like studying or focus or staying awake at work, not falling asleep while you're driving a 10-hour trip, things like that. And don't do it along with pleasure activities. It's not meant for that. Another medicine that we've used for years is an antidepressant called Wellbutrin. Now, it does increase dopamine, and it also increases epinephrine, adrenaline. Wellbutrin's a good drug for addictions. It works well for depression, but you have to know who to prescribe it to. Certainly don't want it to prescribe it to an angry man or a patient with bipolar illness. It actually works for depression entirely different than the serotonin drugs like Prozac and Lexapro and Celexa and that group of medicines. Serotonin drugs can work well for depression, but they can also make you apathetic, and they can really cause sexual problems. So, and apathy. So sometimes I use Wellbutrin together with a serotonin drug. Sometimes I use Wellbutrin to get people to stop smoking or to quit drinking. It works pretty well for those. To be honest with you, I really like Wellbutrin. It's a dopamine drug. There's also a lot of ways you can raise it naturally. Exercise, of course, is good, but you can also become addicted to exercise. And I know many people who do this, and it actually hurts them down the line. They actually overtrain and keep their bodies too inflamed. So too much is not good. Moderate exercise is actually more healthy for your heart than intense exercise. Now, I do like HIIT training short periods of intense, but not 4 hours in the gym. That's too much, unless you're maybe an Olympic athlete. But I don't think anybody listening here tonight is an Olympic athlete. So another thing, social connections can help raise your dopamine levels. Oxytocin is a supplement that we prescribe a lot that really raises your dopamine levels. You know, it's that hugging hormone, the feel-good hormone, that's responsible for a lot of things: uterine contractions, milk letdown, bonding with the baby, etc. We use a lot of oxytocin in our practice because it increases dopamine. It's very safe. There's other supplements too, like a certain type of purine called velvet beans. Now, the thing about these things, they're intense. I've never tried them. I've known people that have, and if they take too much of this, they just go nuts. So be very careful if you use those velvet beans. I like one called L-tyrosine. It's a lot safer. It's really a precursor to L-dopa. So L-tyrosine, I've used it for ADHD, for people that didn't want to get on a stimulant like Adderall. I've also used it along with Adderall. You know, it's safe to take them together. It actually helps Adderall work better, and maybe you can take a lower dose of Adderall. Again, do not use this for bipolar patients. You got to be careful. Another great one is an old-timey over-the-counter supplement called Huperzine A, which increases dopamine, but also acetylcholine. We use that for Alzheimer's disease. And I really think it's as effective as Aricept or Namenda, the expensive prescription medicines that have a lot of side effects that really don't work well at all for Alzheimer's disease. Phenylalanine over the counter also increases dopamine. There's a lot of uses for phenylalanine. They even use it for vitiligo in creams, but it works for a lot of different reasons. Think about phenylalanine, PEA. I like one that Life Extension makes that I take, not all the time, but just when I need it, called Dopamine. And it's from wild green oats. It's very safe. It just mildly increases your dopamine levels when you think you may need it. So dopamine's really just a fascinating neurotransmitter. You got to be very smart with managing your dopamine. All of us do. Think about your baseline and your peaks. You get too high and you get too low. And do healthy activities to increase dopamine, like exercise. A couple other things you can do are cold exposure, which also helps your immune system. You know, a lot of times almost every morning after I get in my infrared sauna, I'll take a really cold shower. And that's been shown to really promote dopamine for about 3-4 hours. They say it will increase your dopamine by 10 times. Now, maybe that means jumping in real cold water, kind of shocking your system a little bit. You got to be careful with that. But certainly a cold shower is an amazing thing to get your dopamine going, and it activates your immune system as well. It actually has been measured at like 10 times the dopamine level from your baseline, kind of similar to an amphetamine. And it just lasts a lot longer. Of course, it's very much safer than something like cocaine or amphetamines. So look at how it works for you. Practice gratitude. That's another thing that will really increase your baseline dopamine levels, is just having gratitude in your life. So don't focus on the prize. Focus on the fact that your pain will turn into rewards. That's why when you practice for a sport, it's actually the practice. If you think of that as being your reward, then you won't get so high when you win during the competition, and you'll be a lot better athlete for that. You know, a lot of athletics is in your mind. The psychology of athletics is just, really most of it, once you train your body to a certain level, that can be the difference between being really good and great and being legendary. So it's the effort that you associate with the pleasure, and that's what's rewarding. Another great thing that you can do besides cold exposure and these other things we've talked about, the supplements, the drugs for it, is intermittent fasting. Intermittent fasting increases your dopamine levels. With all the great things intermittent fasting does for your energy levels, for decreasing your weight, fighting obesity, it also makes your brain clear up and makes you feel better. It's almost like rewarding yourself for depriving yourself for 16, 17, 18 hours of non-eating. It has those great side effects of weight loss, increased energy, increasing your immune system. So, as you know, I'm big on intermittent fasting. So, this has been a great talk. I love talking about dopamine. There's certainly a lot of ways you can go. You need to talk to a professional that can really help guide you with how to manage the highs and the lows, the peaks and the baseline of your dopamine levels. So think about your dopamine and practice gratitude. I certainly do every day. I'm gracious for all the great patients that we have out here that even take the time to listen to stuff. Thanks. This is Dr. Tom Rogers at Performance Medicine. I'll see you next week.